looking at what we know from stress is that stress makes symptoms of illness worse, right? There's almost no circumstance where somebody who is ill or chronically suffering from any symptoms of depression, PTSD, addiction disorders, even chronic pain, insomnia, anxiety disorders, and other physical illnesses, there are very few situations where those symptoms don't get worse under emotional or mental stress. So thinking about that is really interesting because it helps us to understand that perhaps there's something going on with the stress response system itself, and that when you give somebody a medication, the medication's role is not to say to the patient, which is the unfortunate mistake that it's not just doctors making, it's, in large part nurse practitioners and other people who have prescription power or who are clinicians that have, recommendation power, even natural practitioners that will say, oh, take this supplement, take this medicine, and then this will make you better. This will relieve your symptoms. Well, that it may help optimize your system to help you relieve your own symptoms, but the medicine is not actually going to fix your problem. There are very few situations in medicine where the pill is actually the solution to the problem. Those situations are like infection, right? Where there's an antibiotic that you take to treat an infection, and that antibiotic disrupts the bacteria or helps the body in some way actually fight the infection. Ultimately, regardless of what it is, regardless of the pill, the body is doing the work. The antibiotic is just helping to facilitate. And this is the same with almost every other medicine that we use. It's that the healing ability of the healing process that comes from us. And the medicine is optimizing the system to be able to heal more effectively. If we look at the medicine as the answer, that will be the cure to heal us, which is what many of us have been taught, then we externalize the role of the healer to the medicine rather than to internalize it to ourselves. So it's actually disempowering us to heal because we're taking that responsibility of healing and saying, this is on the medicine. The medicine's role is to heal me. So by changing the way, again, from the mental understanding perspective of how we look at medicine, it can actually dramatically shift our outcomes as how we see our own role in our own healing process. Does that make sense?
Absolutely. Like if I can maybe kind of rephrase so I can understand what you're saying, it's almost as if instead of saying, I have a problem, here's a medication, the medication's going to fix the problem. What should be doing is the medication should be a stimulus for the body to come together and rally the troops from all of these different parts, the physiological, the emotional, the different organs that play into that problem that you have, and say, we're going to handle this together. And the pill or the powder or the tincture or whatever it is, it's just the stimulus to get those things all on the same page.
Exactly.